Thank you for allowing me to speak on behalf of Jubilee Scotland. It's a pleasure to be here. So as MJ said, I'll be taking you through our case study that was in the History Repeated 2 report. This was actually authored by Dr. Lena Christensen, so thank you very much to her for creating this for Jubilee Scotland. Our case study is shameless profiteering in Scotland, and as MJ said, unfortunately, the PPP model in various forms has been used in Scotland, damaging us domestically, but also being used as a case study of how it's working in the north, and it isn't. It really isn't. Our case study looked at hospital car parking during the COVID-19 pandemic. To give a bit of context for this, the Scottish National Health Service, known as the NHS, provides healthcare to patients free at the point of use. This is something that we're incredibly proud of. However, research shows that for the past 30 years, most capital investment in the NHS has been undertaken through private finance initiative, PFI, which is one of the many PPP schemes that are out there. This is where the private sector finances the design, the build, and the operation of hospitals, which are then leased back to the NHS Trust over a period of decades. In some cases, this includes the car parks. There was a time when a patient or visitor needing a full day worth of parking at Glasgow Royal Infirmary could pay up to £18 for the day's parking. This is around, it's almost €21. A member of staff could pay for a year of car parking up to £1,500, which at the time was around €1,744. These high fees were contentious to begin with, but the pandemic compounded this issue. In March 2020, the coronavirus lockdown began in Scotland. Restrictions were introduced in various parts of our lives, including a recommendation that we avoid public transport. To support this, the Scottish Government dropped parking charges for staff, visitors, and patients at Scotland's 3 PPP hospital car parks. The hospitals were Edinburgh Royal Infirmary, Glasgow Royal Infirmary, and Ninewells Hospital in Dundee. This was not required, the dropping of fees was not required at the publicly owned hospital car parks because their fees were waived and scrapped in 2008. The cost of scrapping these fees during the COVID pandemic was not borne by the private consortiums that owned the car parks. It was borne by the Scottish Government and therefore by extension by the Scottish public. This was because the contracts entitled the private owners to compensation for any changes to their profit-making abilities, even during a global pandemic. This meant the Scottish Government paid over £5,595,000. This is the equivalent of over €6.5 million to private companies to provide free parking at the 3 hospitals during just 1 year of the COVID-19 pandemic. To put that sum into perspective, that could have paid for a year's salary for 137 experienced nurses with specialised skills. In other words, these public funds could have been spent on additional staff, much needed safety equipment, and urgent patient care at a time where we had an all-time high of requirement. PFI expert Dexter Whitfield, who is on Jubilee Scotland's task force for Scotland Against PPP's campaign, suggests, and I'm partly quoting here, continuing to extract profits irrespective of the social and economic consequences for the people of Scotland indicates that these companies believe they have absolutely no responsibility whatsoever to the Scottish NHS or to the public in Scotland. Essentially, while public institutions and the general public can band together in times of emergency, such as a pandemic, private companies are only accountable to their shareholders. This, for us, begs the question, how can private finance, where profits must be made, ever give undivided loyalty to public good? In 2021, the government struck deals worth £35 million, which is over 40 million euros, to buy out 2 of the car parks in question. This was at Glasgow Royal Infirmary and Ninewells in Dundee. The car park at the third hospital, Edinburgh Royal Infirmary, has not been bought out as far as we're aware, because it's bound up in the contract for the whole hospital, making it very difficult to buy out one section. Currently, though, the car parking fees are still suspended, meaning it's free to park there, but we don't know how much this is costing the Scottish Government, and by extension, the Scottish taxpayer. The cost of parking at hospitals revealed inequalities in access to healthcare in the NHS, which is supposed to provide treatment free at the point of use. This case study is an example of the inflexibility of PPP contracts, highlighting the lack of accountability to the public, and shows the additional costs that they bring to public services. Since the beginning of our Scotland Against PPP campaign, we've gained cross-party support, which we're incredibly pleased about, for finding an alternative to PPPs in our public infrastructure. This has included a working group meeting at Parliament, and we're hoping to have a second one in October or November, where we discuss our recommendations. I'll put the link to our recommendations draft in the chat after this. Just as they did in 2020, we believe the Scottish Government needs to recognise the issue with PPPs and step in. But this time, instead of paying off the private consortiums, we need to find an alternative to PPPs going forward so that these problems cannot be repeated. And we would call on MDBs to learn from these mistakes in the Global North and the Global South. Thank you very much.